Let me tell you a story. It was a quiet morning, just like any other. The kind of morning where nothing seems wrong, where life feels ordinary, predictable, safe. But for Michael, a 57-year-old father of two, that morning marked the beginning of a journey he never expected. He woke up, walked to the bathroom, and for the first time in his life, he saw a drop of blood in his urine. Just one drop. No pain, no fever, no drama. But that single moment changed everything. That tiny drop of blood was a whisper, a quiet, almost invisible warning from his body. And like so many men do, he almost ignored it. Almost. 3 weeks later, he found himself sitting in a doctor's office, palms sweaty, heart pounding, hearing words no one ever wants to hear. You have prostate cancer. Now, here's the part that breaks my heart. If Michael had waited just a few more months, if he had brushed off the signs like millions of men do every single year, his story would have ended differently. You see, prostate cancer is not the kind of disease that arrives with fireworks, alarms, or loud warnings. It's a silent visitor, quiet, patient, persistent. And that is why today, I want to talk to you, man to man, heart to heart, about the signs, the stories, the science, and the urgent truth behind prostate cancer, the truth I wish every man knew before it was too late. Because your life, your family, your future, they're worth more than silence. Prostate cancer remains one of the most common cancers in men, yet it is also one of the most misunderstood. Here's the paradox. It is common, but often ignored. It is treatable, but only when found early. It is silent, but the consequences can be loud and devastating. 1 in 8 men will develop prostate cancer. In many countries, hundreds of thousands of new cases appear every year. Early detection brings a survival rate close to 98%. Late detection, that number falls sharply, but numbers don't tell the emotional truth. Let's look at the human truth. Men ignore symptoms. They postpone checkups. They tell themselves, it's fine, it's age, it's just stress. Men are taught to endure pain, to keep quiet, to push through discomfort. But prostate cancer thrives in silence. That's why today's message matters, because knowledge is not just power, it's prevention. Awareness is not just education, it's survival. 1. Frequent urination, especially at night. A man wakes up once at night, normal. Twice, still common. But when you wake up 5 or 6 times every night for weeks, your body is speaking to you. The prostate surrounds the urethra like a ring on a finger. When it enlarges, whether from benign causes or cancer, it squeezes that tube. Imagine pressing your finger against a straw while trying to drink through it. That's what your bladder feels. 2. Painful ejaculation. Rarely talked about, often ignored, frequently misunderstood. Pain during ejaculation is not just stress, nor just age. It can indicate inflammation, hormonal imbalance, or structural changes inside the prostate. 3. Blood in urine or semen. A drop of blood is never nothing. Cancer can cause fragile blood vessels around the prostate to rupture, but so can infections, stones, trauma. Either way, blood is a bright red flag you should never dismiss. 4. Pain while sitting. Men often blame this on sitting too long, bad posture, or a strained muscle. But persistent pelvic discomfort, especially pressure deep inside, can signal prostate swelling or tumor growth. 5. Persistent pain in the back, hips, or chest. This appears in advanced cases when the cancer has spread to bones. Bone pain from metastasis is different. It's deep, constant, doesn't get better with rest, worsens over time. If this occurs, medical attention is urgent. 6. Swelling in legs or feet. When cancer blocks lymphatic drainage, fluid collects, especially in the lower limbs. 7. Unintentional weight loss. When your body burns energy fighting cancer, weight drops rapidly, despite normal diet. 8. Numbness or weakness in limbs. Advanced tumors can compress the spinal cord, a medical emergency. Now let me put on my doctor's coat and speak from experience. Each of these symptoms is like a puzzle piece. Alone, one piece might look harmless. Together, they create a pattern no physician can ignore. Why men miss these signs? Because men tolerate discomfort. Men excuse pain. Men fear diagnosis. Men trust it'll pass on its own. But cancer doesn't care about excuses. It grows in silence. The science behind prostate warning signs. When the prostate enlarges, it blocks urinary flow. It causes inflammation. It disrupts normal hormonal balance. It affects surrounding nerves. It may obstruct lymph vessels. Your body always knows first. It whispers long before it screams. The man who waited too long. Lucas, a 61-year-old retired engineer, never wanted to bother anyone. When he started waking up at night to urinate, he brushed it off. When sitting became uncomfortable, he blamed his chair. When blood appeared in his semen, he told no one. 6 months later, he visited the hospital, only after collapsing in his living room. His cancer had spread to his spine. He once told me, with tears in his eyes, "If I had just listened to my own body, I'd have years more with my grandchildren." The silent warrior. Samuel, 49, discovered prostate cancer early during a routine exam. No symptoms, no warnings, just a proactive health check. Today, he is cancer-free. He told me, "The checkup I almost skipped saved my life." The weight loss. That meant something. David thought losing 10 kilograms without trying was a blessing. It wasn't. Cancer cells consume vast energy. His weight loss was the body's cry for help, but he listened too late. The father who wanted more time. Miguel felt numbness in his legs. He thought it was due to cycling, but it was spinal cord compression. He survived, but with permanent nerve damage. The survivor who became a messenger. Tom, 55, beat prostate cancer after early detection. Now he speaks publicly, reminding men that bravery isn't silence. Real courage, he says, is facing the truth early. Risk factors: 1. Age risk spikes after 50. 2. Family history. A father, brother, or close relative doubles the risk. 3. Race: African American men face higher and more aggressive risks. 4. Lifestyle: high-fat diets, processed meats, obesity, smoking, all raise risks. 5. Hormonal imbalance. High testosterone levels over time may contribute. Detection is not just a medical act. It is an act of love for yourself and your family. PSA, ultrasensitive testing, multiparametric MRI, MPMRI, AI-assisted lesion mapping, MRI fusion biopsy, genomic risk scoring, biomarkers like PHI, 4K score medicine is evolving. Survival is rising. Hope is growing. 1. Eat these foods often. Tomatoes, lycopene, broccoli and cruciferous vegetables, salmon and omega-3 rich fish, green tea nuts, olive oil. 2. Reduce these red processed meats. Excessive dairy, sugary drinks, alcohol. Smoking. 3. Move daily 30 minutes walking. Reduces cancer risk by 20 to 30%. 4. Maintain a healthy weight. Fat tissue. Produces inflammatory hormones. Promotes tumor growth. 1. If it doesn't hurt, it's fine. Wrong. Prostate cancer is often painless. 2. I'm too young. Cases appear as early as age 40. 3. Tests are embarrassing. Embarrassment never killed anyone. Cancer can. 4. Healthy lifestyle means I'm safe. It reduces risk, not eliminates it. 5. If I ignore it, it'll go away. Cancer never disappears by being ignored. 6. PSA is enough. PSA is helpful but not perfect. MRI and biopsies may be needed. If I could leave you with one final message, it would simply be this. Your health is a promise you make to yourself and to the people who love you most. A promise to stay present, to stay strong, to stay alive for the moments that matter. Prostate cancer may be silent, but your life, your future, your voice should never be. So today I ask you, not as a doctor, not as a narrator, but as someone who genuinely cares, listen to your body. Don't ignore the whispers. Don't wait for the screams. Get checked. Take the step. Protect your future. And if this message touched you, taught you something new, or made you think even for one moment about your own health, then hey, you and I might just make a pretty good team. This is Nourish today, where we don't just talk about health. We protect it, we celebrate it, and sometimes we laugh about it too, because a little humor keeps the heart young, so don't be shy. Hit that subscribe button like you're checking your prostate, gently, responsibly, and preferably once a year. Trust me, this way is a lot less awkward. And while you're there, go ahead and tap the like button too. Make it feel loved. It's free therapy for the algorithm. Share this video with a friend, a brother, a father, or that one guy in your group chat who thinks he's invincible, but gets winded walking up one flight of stairs. Yeah, him. He needs this. Thank you for watching, for caring, and for choosing to nourish not just your body but your awareness. This is your reminder. Your health is your story, and it deserves a long, beautiful, powerful ending. I'm here for you. This channel is here for you. Stay safe, stay aware, and as always, nourish your body, nourish your mind, nourish today.